everyone, it's DocTalk. We are at Memorial Day weekend of all things. We are to warm weather. A lot of you are in places where the hot weather is really coming this week. I'm looking forward to going swimming, and it'll be a fun weekend. I hope for that. We are in a transition time related to all of our infectious diseases. So let's move through a couple of them. Number one, and very importantly, COVID. We are at clearly a little upswing again, a new variant related to Omicron. So it has a designation. It's the BA2 12.1. It's now the dominant one in the country. Very infectious, marked by breakthrough infections for people vaccinated as I am and boosted as I am. And I still got COVID. People who've had a prior infection with one of the earlier variants and in some cases vaccinated, and they picked it up. It is fortunately at this point not showing signs that it's putting a lot of people in the hospitals. I'm in the Dayton community. Today, our weekly report is there's only a handful of people in the entire community who are sick enough to be in the intensive care unit. A few in the hospitals, but not nearly as many as there are related to mild disease that's in the community. I just traveled and I had a lot of questions about masks. And so we're going to review masks again as part of this. So number one infectious disease we're still concerned about is COVID. If you have an opportunity to get vaccinated, do so. It is now anticipated in June, the FDA and the CDC will approve the vaccines for children 0 to 6 months to 6 years of age. And this past week, they approved boosters for the 5 to 11 age group. So for those of you that have been waiting for your children to get out of school and get them vaccinated or boosted, now will be the time. Second, as we end the school season, we've had a lot of infectious diseases running amongst the kids. We are still monitoring flu, which is very unusual at the end of May, and still some outbreaks of influenza A. And ordinarily, we wouldn't even be measuring those, but they're still in some communities. And in some communities enough that they've kind of highlighted people who are at risk should wear their masks. Infectious problem number 3 is a new bug to our area. It is called monkeypox. Monkeypox is another of the pox viruses. An outbreak, a small outbreak in Africa, has resulted in some cases spreading across the globe. We have a few in this country. A pox virus is a rare virus, and it causes symptoms that include fever, a little bit of upper respiratory congestion, but most importantly, an outbreak of a blistered rash or a pox rash and enlarged lymph nodes. This is an infection that is not a big risk to EMS, but if you see somebody with a fever and a rash, you immediately say, even if I didn't come in with my N95 on, I'm putting on my N95 now, and I'm going to minimize my exposure and the exposure of the rest of my crew. So I promised you a mask review. I told you I just traveled, and a lot of people still in the airports and on the airplanes and in the trains are wearing their masks. Still 3 varieties. A plain cloth mask, which protects other people from you and filters some incoming respiratory bugs in particular. A surgical mask, which is a little more effective in protecting you, but is clearly effective in protecting other people from you. And then up to the N95s or our respirator or canister masks that filter very effectively. And this is you protecting yourself from other people in the highest degree that's available. So N95s are what will protect you on an ongoing basis from COVID and other related respiratory viruses, and from the new disease like monkeypox or related things. So highest level of protection. This is also the time of the year when occasionally meningococcal meningitis goes around. It is a very dangerous disease, and one which causes severe headaches, stiff neck, fever. These are people who are really ill. They break out in a very different kind of rash, which is a breakdown of their capillaries, and they get a fine pink rash that, if the case gets worse, can progress to purplish discoloration in a very sick patient. I happen to have seen one of those recently, and that individual died. And so meningococcal meningitis, you protect yourself by N95 masks. So mask protection still important in infectious disease patients that we're dealing with now. For those of you that are in outbreak areas where the new variant of COVID is getting concerning again, when you're indoors, you may be moving back to your cloth mask or to your surgical mask. And in patient encounters with infectious diseases, moving back to an N95. This week, we also move into Memorial Day weekend. Please, as you're having fun with people around you, as we should be moving into, please think about your own health and think about the things that are part of our usual safety at this time of the year, which is heat-related safety, water and boating, and don't drown related safety. You're going to have some adult beverages, and with the adult beverages, never nice to operate any kind of machinery. Please don't be boating, operating your ATVs, motorcycles, or automobiles under the influence. And then as we're traveling, the roadways have become a dangerous place again. We just heard the news this past week that our traffic-related fatalities in the country are at levels we haven't seen for about 15 years. We've been on a long-term down curve related to traffic fatalities. We had a little blip a few years ago, but there was a very significant blip in 2021. So be careful when you're out on the roadways. And then, as I said, we're back again flying and taking other mass transportation. And I'm urging you, as I did when I was out traveling, put your mask back on. I was using an N95 because I'm protecting myself from other people. So we go up to the N95s. That's good advice as we get into the holidays. So Memorial Day, enjoy the time. DocTalk this week. We feature one of the new diseases that's getting some headlines, smallpox, but COVID is still around, and other respiratory infections. Those will begin to decrease as the kids get out of school. And many of you are in a position where the kids are out of school. Go on vacation, have a good time, take care of your family, and I'll see you in a week. DocTalk, happy Memorial Day.